According to the World Health Organization, immunization against diseases averts an estimated 2 to 3 million deaths annually, while an additional 1.5 million deaths can be avoided if global vaccination improves. This improvement is what the Chief Executive Officer of Global Alliance for Vaccination and Immunization wants to see in Nigeria, as he and his team visit the country to assess the level of commitment by the government. The GAVI team, accompanied by officials of the National Primary Healthcare Development Agency and representatives of the Niger State government, is in Suleja local government area of the state to meet with the traditional rulers and seek support in addressing the issue of non-compliance by the people.
The coverage rate in Nigeria is lower than it should be, and as a result, children in Nigeria are dying from these diseases unnecessarily. About a year and a half ago, this was recognized by the government, by Dr. Faisal, who's next to me, and a national emergency was declared to try to increase routine immunization. This visit was part of that discussion to see the progress that's being made and also to sensitize political leadership and, of course, traditional leadership to the importance that is here.
According to Mr. Berkeley, the GAVI intervention in Nigeria is expected to end by 2021, but an extension could be considered if the government shows more commitment.
The decision that will be made on whether GAVI can continue to provide support after 2021 will be based upon the commitment that's been shown by the government and the improvement that is done.
The Federal Ministry of Health and the National Primary Healthcare Development Agency, working with development partners, took a stance and say, unlike in the past when we see coverage surveys that showed that we're not doing enough, we're not reaching our kids, for the very first time last year, we accepted the results.
For the Commissioner of Health, there's a zeal to change how the local people perceive immunization.
And that the time has come for us to do real evaluation, get real results, and know where we are. And that's the first step of showing commitment. Thereafter, we'll now move from there.
According to the Global Alliance team, Niger State has had the lowest immunization statistics in Nigeria, with only 20% of the children vaccinated. GAVI's goal is to help the state achieve its target of changing those statistics to positive figures.